We have an offer for couples who once created and froze embryos, or are currently undergoing IVF in their country and are going to freeze embryos. Frozen embryos can be sent to Ukraine. We will transfer them to a surrogate mother, and she will carry your child. This surrogacy program is called CARE. If parents have extra frozen eggs and sperm, they can also send them to our clinic. If the embryos don't attach, doctors can make additional IVF attempts. Parents do not have to come to Ukraine to start the program. They can sign the contract remotely through the interaction with a trustee, and they can choose a surrogate mother on the profile and after personal communication on Skype. Let's talk about several nuances of the CARE program. The most important thing is that the embryo must be created with the use of biological material of one or both parents. That is, they should use either the wife's egg plus husband's sperm, or the donor egg plus husband's sperm, or the wife's egg plus donor sperm. The main thing is that the use of donor cells should be permitted by the law of your country. Then parents have to collect several medical certificates. Usually this is not a problem, because couples do such paperwork before undergoing IVF. So what documents do doctors need? Firstly, they need a document that confirms that the potential parents did not have infectious diseases at the time of the embryo creation or the retrieval of biological material. We will need the original results of each medical research. Moreover, it should take no more than 3 months from the time of the test to the time of retrieval of the biological material. This set of documents includes blood tests for HIV, hepatitis B and C, and syphilis. Such tests must be passed by both spouse and donor. In addition, each type of biological material that parents send must be accompanied by documents. Our task is to get the maximum information about the analysis. An embryo cultivation protocol should be sent together with the embryos. It should contain information about the quality of the embryos, as well as on which day and how these embryos were frozen. The clinic must indicate the method of freezing, and some clinics also add a defrosting protocol. You should send a spermogram, a karyotype analysis, and other studies that have been conducted together with sperm. An ovarian stimulation protocol, ultrasound protocols, a protocol with a description of the puncture should be attached to the eggs. The document should indicate the number and quality of eggs, as well as the day on which the puncture was performed. Also, the method of egg freezing must be necessarily indicated. And one more question. How to send embryos to Ukraine from another country? There are specialized international companies that are engaged in medical transportation. A thermos with biological material and a package of documents are transferred to the clinic by a courier. Courier service, parents, our agency and clinic must agree on the date and time of the delivery of the biomaterial. All materials are accepted by the embryology department. Doctors should be prepared to receive the container and prepare the conditions for further embryo storage. Parents choose the transport company on their own and give it a power of attorney for the biomaterial transportation, and the clinic receives an official certificate of the parcel reception and transmission. We can recommend several companies that we worked with before, but the final choice is up to the parents. When embryos arrive to a clinic in Ukraine, doctors begin to prepare a surrogate mother for embryo transfer. They will also study the embryos and recommend how much and which ones are worth the transfer. And in such case, the decision on how many embryos to transfer, 1, 2, or 3, is made by the parents too. We keep the remaining embryos during 1 year. Speaking about all other aspects, the CARE program includes the same stages and processes as the other programs do. We completely organize the medical part of the program, including childbirth for the surrogate mother. We help with all paperwork for the child. We accompany the couple at the embassy. Parents have a personal manager, interpreter, who informs about the course of the pregnancy, helps them, and accompanies in different instances. There is the additional information about the programs on our site. You can also write or call us to get more details.